Dr. Dana Mazo. I'm an infectious diseases physician. I'm an assistant professor at Icahn School of Medicine at Mount Sinai, and I'm the hospital epidemiologist, the physician lead for infection prevention and antimicrobial stewardship at Mount Sinai, Queens. Thank you for joining us today. So first off, it's completely reasonable to be anxious. We are in uncharted waters right now. This is a very different situation than what everyone is used to. When we go to the unpause, when we stop sheltering at home, it's not going to be right back to how life used to be. It's going to be the new normal. But the good point here is that we have been practicing during the pause. We have been practicing all of the measures we need to take to keep us safe once we are in the new normal. When we have the unpause, when we can go outside again for reasons other than for essential reasons, then we will continue to practice social distancing, wearing masks, cleaning high-touch surfaces, as well as hand hygiene. Those are the key aspects, the key behaviors that everyone can do to keep us safe. The other key thing here is that it's not going to go from our current pause, sheltering in place, to life going everything back to the same. The mayor and the governor will reopen things in stages. So we will have time to get used to each new stage and how to adapt. To keep yourself safe, as well as your loved ones and the people around you, it is important to keep doing all of the behaviors that we've been doing. So you want to wear a mask, and remember, the mask serves two roles. The most important role of the mask actually is to protect the people around you, because even if you're not feeling sick, you can still spread coronavirus. People without symptoms or who have not yet developed symptoms, if they are infected with coronavirus, can still spread it to other people. But if you wear a mask, then it keeps the virus closer in and makes it less likely to spread other people. Similarly, if both you are wearing a mask as well as someone else, then if both people are wearing masks, then it also really reduces the spread, but doesn't stop it completely. And that's why wearing a mask is not sufficient. You should still practice social distancing, i.e. trying to keep more than 6 feet away from other people, as well as washing your hands. Washing your hands is the most important measure that you can do to prevent spreading coronavirus or contracting it yourself. The way the virus is spread is that it is droplets in our mouth. And so it's either spread directly while if you're talking or singing, coughing, shouting, that then the droplets can spread from your mouth to someone else who is within 6 feet around you, not wearing a mask. However, also the droplets can fall on surfaces. So if I'm talking, it could fall on my desk, and then someone else could touch my desk and then touch their face. And that's why it's really important to wash your hands, especially before touching your face, because that's another way that you could contract coronavirus. So wearing a mask is important, but not sufficient. If you're wearing a mask, you still need to practice social distancing, because again, masks are not ironclad armor. So you still want to be careful and practice social distancing. But in addition, you want to wash your hands and clean frequently touched surfaces so that to prevent that other way of contracting coronavirus through what we call fomites, when the virus is present on surfaces and then I accidentally touch the surface and touch it to my face or my mouth or my nose, the three parts of our body through which the coronavirus can enter. And the one last thing, which is very important, is if you're not feeling well, if you have fevers, if you have cough, headaches, that you should stay home. Well, the good thing is that your likelihood of contracting coronavirus outside is less than your likelihood of contracting virus inside, because when you're outside, it is much easier to social distance, as well as it's much less likely that you're going to touch the same surfaces as other people. So being outside is good, not just for your peace of mind and enjoyment, but also it is harder to spread coronavirus. That said, if you're outside and you're close to a lot of other people, you do still have the risk. So the best recommendation is to go outside, but when you're outside, try to avoid large groups of people, and try to, not spend a lot of time around people who you haven't already been, sheltering in place with in your apartment. Mount Sinai Queens, as well as the other Mount Sinai hospitals, have all been working very hard to make sure that we can safely return to more normal operations once more normal operations are allowed again by the governor and by the mayor. So what we've been doing is we have much more access towards testing patients before they come in. We also have been doing a lot to make sure that our patients can socially distance while in waiting rooms. Also, we have a pretty active screening of patients for symptoms before they come in. Patients are called within 48 hours before their scheduled appointment, and then when they come in for the appointment, they are also called and asked about the screening symptoms to make sure that they do not have active symptoms or concern for active COVID. Now, again, if your reason for coming is concern for COVID, or if you have an urgent need and you do have symptoms, we will address that appropriately. So the main ways that Mount Sinai Queens is preparing to return is to allow social distancing, to have staff as well as patients wear masks. We've been doing a lot of cleaning. So everything I said about cleaning high-touch surfaces is another way that we're also doing it here in the hospital and the ambulatory clinics. Lots of capabilities for hand hygiene. You'll see hand sanitizer everywhere to make sure that people can wash their hands, but also screening for symptoms, both our staff as well as our patients, and when appropriate before high-risk procedures, doing testing of our patients. I think the main thing is that to feel confident that you already know what you need to do to help protect yourself and your family once the pause is over. And remember, as I said, the pause won't just go away all at once. It'll come back in gradations in a safe way. And those gradations will be dictated by how much COVID we think is happening in our community. So there are certain milestones that the city and the state will be following to see what is the risk of having larger and larger gatherings. That said, you should still follow the same things which you're doing now. Most important things, washing your hands, especially before touching your face. Cleaning high-touch surfaces frequently. Social distancing, staying more than 6 feet away. And if you can't practice social distancing, which I can understand in my office, right now I'm not wearing a mask, but when I have to go talk to other people for work, I have to put on my mask. So when you can't practice social distancing, wearing a mask. And then equally important, if you're not feeling well, to stay home and not go out unless absolutely necessary. And the important thing here too is that the hospitals are doing a lot of work to make sure that our patients can be treated safely. So if you are sick and you need to go see your doctor or you need to come to the emergency room, it is safe to come to the emergency rooms and to go see your doctors. We want to make sure that all of our patients get the care that they need.